Hello Shady lovers, welcome to the continuation of the lipids management in kidney failure. So I was explaining why statins will not be started in a patient that was not already on these statins medications, such as the atorvastatin, rosuvastatin and all of that. However, with these statins, from chronic kidney disease stage 1 to stage 4, they are safe to use them and the guidelines recommend their use. Then patients that are on dialysis, that's where we have to clarify. This is because when the patient is not an existing statins patient, that's somebody already taking this statin, it wouldn't be advisable to put them on statins when they are on dialysis. This is because the kind of issues that we are experiencing, the lipid levels or issues at the dialysis level, is not driven by these atherosclerosis. This is not driven by cholesterol, but it's driven by other factors, three factors that's got to do with the structural calcification, and it's got to do with the rhythm or rhythmics beat of the heart. So I'm going to explain this individually. What happens in here is the fact that, let me take the structural. So the reason why we are not giving statins to a patient on dialysis who is not statins on the dialysis patient is because at this point, structurally, there is something we call left ventricle hypertrophy. That means there is the thickening of the left ventricle muscles. So normally, assuming the heart, that's the chamber of the heart that pumps the blood into systemic circulation, assuming it's that big, it becomes thickened, the muscles become thickened, so it affects contractility and all that. And the other thing is got to do with the fact that there's a stiffness in the blood in the heart walls, and this is because of long-term pressure or blood pressure and fluid overload that was not managed. The next thing is got to do with what we call calcification, or with regards to the calcification, it's got to do with the disposition of calcium and phosphate in the blood vessels or in the heart tissues or valves. And when this happens, it's as a result of what we call mineral imbalance, which I've already explained in other videos with regards to the mineral imbalance. So when this happens, it affects the contractility of the heart and the heart functions, and that's really going to that's what contributes to these cardiovascular events such as heart attack or heart issues. I'm going to continue this in the next video. Thank you, Shady lovers.